Hi, Dr. Games. As the first video for this assignment or this semester, I would like to say happy summer, and I look forward to having you again as a professor for the next couple semesters. So with that said, this will be my reflection talking about practice-based research and kind of what experience I have with it, as well as what I think it is. And to be honest, where I'm first going to start is to honestly say that I had no idea what practice-based research was. I think before the program in general, that's where I was, and I saw this class, and I had no idea that's what it meant. It wasn't until I did the first set of reading that I realized what translational and action research was. And I'm looking forward to doing a practice-based research project. I just didn't know that this was the class that went with it. So with that said, outside this program, or once I've been inside this program, I've really learned a lot through others that have gone through the program, as well as working with advisors who've done that, and of course doing my own individual research, and not even just my research projects, but just gathering my own evidence from reading through class and everything, and getting a better understanding. So to me, practice-based research it's taking a real-life problem in a real-life clinic and testing something, anything, to help to improve it, and doing that to impact our patient care or our quality improvement. It's so much more than just a laboratory setting, and I think that that's the biggest difference in my mind of what I've learned is there's laboratory and there's practice-based, but in my project right now, which is in the Chronic Ankle Instability Consortium, I can see how what I'm doing right now is laboratory-based. So let's take, for instance, my segment of the project is doing patient-rated outcome scores and functional assessment tools. And I'm looking at the laboratory-based. So for instance, let's look at the triple hop for distance. The triple hop for distance, I actually did that with one of my patients when she was going through an ACL. And to me, that I'm looking back and realizing that I should have done better at practice-based research, because I didn't do it in her basketball shoes, and I didn't do it on the right surface, and I didn't do it her in the right attire, and it turns out to be not very helpful. So the biggest difference in my mind and what it means to me is it takes an athlete or a patient in their own setting and in their own injury and their own stage of healing, and finding a gap or or something that's missing and fulfilling that and doing research to fulfill that, to fill it up. So going back to my project, instead of doing it on the mat in the lab, you would do it on the grass for a soccer field, a soccer athlete, or you would do it on the basketball court, and seeing if it's still effective. Because that is what it comes down to, right? If it doesn't help, then you have laboratory-based measures, which is great, and you shows that it helps, but if it doesn't help the actual athlete, then you're not actually doing anything for patient care. So for me, that's what it means, and it's taking it outside of the sterile, cold room of a lab and putting it into the sun. I think my only experience with practice-based research is when I first got into the program and I first started my graduate assistantship. I learned all about outcome tools and functional outcome tools, and I was so pumped to get started. So I ran all my athletes through the FMS, which I took time to learn and figure out how to do, and now I know you have to be certified for it. But I wanted to see, I measured their, I took their scores, is what I did. So I scored all of them on FMS and wrote down their scores and wrote down their deficits, and then spoke with the strength and conditioning coach, and we implemented strengthening of certain areas, so doing clamshells or doing hip flexor strengthening, or doing increases in external rotation or internal rotation. Doing those in weights because my setting is not very compliant, or my patients aren't very compliant, so I decided to just implement it into the weight session. And then at the end of the year, I was going to take at the end of the season, I was going to take the FMS again, and I wanted to see if that worked. So a couple problems I ran into for that is that basketball does not do weights throughout the entire year, which was a shock to me because I was coming out of undergrad into a place where weights were done all the way through season, but less consistently. So obviously preseason and off season would be heavy, and then when you got into during season, you would have maybe like once or twice for maintenance. But my girls never did that. Our coaches did not do that. And I found that it was absolutely completely useless because not only did I didn't have anything to go off, I didn't have any measures, and I didn't have any evidence that that actually did the exercises. So I failed, but in a good way. This semester, I mean, there's a lot of things that I'm looking into trying to fix, but now I have a better idea of what I'm getting into. Um, like for instance, some of my ideas, what I really want to do is a stretching program after all the practices and all the games, because we do stretching beforehand and we do an active warm up, but we don't do anything afterwards. And I'm noticing that a lot of the girls that I deal with have a lot of stretching being their biggest, flexibility being their biggest issue with patellofemoral pain or shoulder impingement or, pick anything, tendonitis of the peroneals, all these things have to do with tight calves and tight shoulders and even tight backs. And so that's what I want to do. I don't know if that makes up a good practice-based research question for my DAT, but it's something that I want to implement in my own field. I learned that you gotta be consistent with gathering evidence, and it's a lot of hard work. And I guess it's a bigger time commitment than I thought. So I think that's what I learned from it. Is it better prepared me to actually having a practice-based research? But other than that, I haven't really done anything official. I don't think I've done anything official, but that's like as official as I can get. Outside of that, I mean, I believe that practice-based research is more than just intentionally writing down outcomes. I look at my patient and I see something doesn't work and I change it and it starts to work. And that in my own mind, that's research. It's very informal research, but it's looking at my patients and discovering that there's something that's not working, altering that to find something that does work. And I've done that more often, I think, than I can probably count. Doesn't mean I've actually gotten anywhere, nor does it mean that I've cured cancer or solved any of the big world problems out there, but I feel like in my patients, it's made a difference in its own little way. I think it really helps to have, first of all, I think Emma and Ashley, having them as roommates was awesome because I got such a good view of what I was going into, and they were great influences on me, and working at ISU was a tremendous strength because I was around so many people doing so many different practice-based research projects, and it inspired me, and I learned a lot from them too. Like Kelly, for instance, Normatech, would never have thought to do that, but I got to see her working with real patients who were going to use it anyway and gathering the data to see if it made a difference. And that is huge because yes, in evidence or literature, it probably does work. I haven't personally looked up any information on that, but I don't use it very often too. But to see her and just having them do it before and after, and then having my patients even take part of that was really, really cool to me because I was like, maybe this doesn't make a difference, or maybe it really does. And should I be pushing it? Should I not be pushing it? And that is a really cool thing for me. I was super inspired by Kelly's research project. And then even by Melissa's. I think I'm very much an intervention type of person. I like to see cause and effect. So I loved how she did the blinded study and looked for the differences in range of motion between a Compex and just a bike. And yes, I had to do that. And yes, my arms are sore because I'm a wimp. But I loved it. And I loved seeing just how excited she was about it and how much I could use that in my own practice. Like I could use that with my athletes. And it's so much better than like looking at, it's a totally different avenue. It's not better, but I looked at my traditional research project and I feel like I'm not impacting anyone. I'm not changing any of their lives. I'm just telling them numbers that they don't necessarily even care about. I'm having them do the hexagon test, which is exhausting, and they're not benefiting from it. But I want to do something that benefits my patients. So right now, I'm really excited about it. I think the only question is whether, how specific does a practice-based research, I guess what makes it a practice-based research project, like if it only impacts my patient population, and so for instance, I do something with, so say I did Melissa's with Compex, but I only did it with basketball athletes. would that be something that would impact other people? Or would that be something that other people could build off of? They're like, oh, this works for basketball. What about for baseball? Or what about for volleyball? Like all these questions that I feel like my little research didn't really contribute to the community, but it helped build others' research ideas. So I guess after that whole tangent, my question would be, when we're looking to do practice-based research in any way, shape, or form, do we make an impact to athletic training by just sticking to our population? Should we aim to do a broader scope? Um, and I just feel like I'm gonna make a difference for my patients if I do it, but I don't know if that's good enough. I guess is the weird thing about it. And saying that sounds weird because I know it doesn't sound right. Like I feel like my patients are worth it, but I feel like I should be making a bigger difference. So when I'm looking, for instance, about doing my own practice-based research, is it possible to just do something with my patient population, or should I aim for ISU athletics as a whole? So I guess that's my only question I have about it. Again, as hopefully you can tell, I got really excited about it. I'm looking forward to eliciting change, making it, and just finding all these questions, all these answers. And I have no idea what I want to do, but I'm looking forward to doing it, oddly enough. Anyway, thank you, Dr. Games. I look forward to this semester.